So, getting ready to do a nasopharyngeal suctioning. I have verified the doctor's orders. When I listened to the patient's lung sounds, I heard crackles. I called the physician, obtained orders to do the nasopharyngeal suctioning, and that's what we're going to do today. I have all of my equipment. I have an extra set of sterile gloves just in case I need them. I have the nasal suctioning kit, and I have some saline. The normal saline, it's never been opened. It's brand new. I checked the expiration date. It has not been expired, so it can be used. Before I get started, I'm going to go ahead and enter the patient's room. I will close the curtains for privacy. Before I touch the patient, I will wash my hands. My hands are washed. Okay. Hi, Mrs. Jones. My name is Tasha. Can you tell me your name and date of birth?
7588 and Mr. Jones.
Verify her name and date of birth. I'll explain the procedure to the patient. Mrs. Jones, because you have a few secretions and I heard a few crackles in your lungs, I got a doctor's order and I'm gonna go ahead and suction you, okay? Have you ever had this before?
No.
Okay. It's just gonna be a little tube that's gonna go in through your nostrils and it's gonna go into the back of your throat to help get some of those secretions out, okay?
Okay.
Now before we get started, I'm gonna go ahead and do it. I want to establish a distress signal. Now, when I'm going in, if you feel like you're getting a little bit anxious or it's getting to be too much, I want you to raise either one of your hands, okay?
Yes.
Okay. Now, I know you've never had it done before, but is there anything wrong with any one of your your nostrils? Can I go in either opening? Are they both open?
Both of them are open.
Okay. Which one do you prefer? Do you prefer the right one?
That's fine, whichever one.
So, I'll go ahead and get started. I'm going to position the bed so that I'm comfortable. Going to go ahead and lift the bed up, okay?
Okay.
This is a sterile technique, so I'm going to be sure to remain sterile during the procedure. Position the patient in semi-Fowler's position. I'm going to go ahead and lift your head up a little bit, okay?
Okay.
Before I get started, I want to turn on my equipment. Go ahead and turn the equipment on. Now this particular equipment, for the suction, it needs to be between 110 and 120. I set it on 120. Here it's suctioning. Just going to bring it over by the bed. Just brought a chucks just in case the secretions get liquefied and just will keep the patient dry. I'm going to just put my extra sterile gloves here just in case. I'm going to go ahead and open up my kit. Now before I open up the kit, I'll be sure to make sure that the table is clean and wiped and all of that stuff. Equipment is open. I'll trash this. I'm going to go ahead with my clean hands, take out the kit. I'm just going to squeeze the insides together. Now this is where I'm going to put my saline. I'll open up my saline. Even though it's brand new, I'm going to just go ahead and lip it just to be safe. Have my garbage can here. I'm just going to lip it. Now I'll go ahead and pour some of the saline in. Get it out of the way. I'm going to go ahead and open up my equipment. Set up my sterile field now. I'm going to take these skulls and kind of fold them back. Now you do have a 1-inch border on your sterile field. I'm going to go ahead and don my sterile gloves. Take the first one. I'm going to step back. I got an extra set. Thank God I do. I'll go ahead and attempt to try to put this one on. I'm going to hit check my thumbs. I didn't contaminate it. So now since this one's on, sterile can touch sterile, I can use this hand to fix this one. I am Still sterile. Did not break sterile technique, and both of my gloves are on. While I have two hands, I'll go ahead and open up my lubrication and just put it over here in this small area. Gotta get my catheter out. Now, while I have two sterile hands, I'm just going to stop and do a reality check. Intermittent suction is on. Sterile gloves on. Saline is in my cup. Patient is up. We got the distress signal. Orders are verified. We can go ahead and get started. My dominant hand is my right hand, so this will be my sterile hand. So I'm just going to take both. I'm just going to take the equipment and try to coil it. Best of my ability. Now, in the checkoff, it said to take away oxygen delivery if indicated. So with my non-sterile hand, once I get this full, this is still sterile. So with my non-sterile hand, I'll go ahead and take off the nasal cannula. I'm going to go ahead and connect my catheter to the equipment. Connected, it's still sterile. Now everything from the green part back is considered contaminated. I'm going to go ahead and check the equipment to make sure that it's working. I'm going to go in and suction a little bit. It's working. Nasal cannula is off. The nasal cannula is off, so now I'm going to go ahead and go in. But before I go in, I want to lube. I'm going to only lube 1 inch. I'm just going to only lube the tip because once you get the lubrication, it gets a little lubey and wet. I'm just going to go ahead and lube. It's still sterile. Okay, Mr. Jones, we're getting ready to go in, okay? I'm going to go in on the count of 3. 1, 2, 3. Going in. Going in the direction of the opposite ear. I'm going to go in about 5 inches. She's starting to cough. I'm going to go ahead and suction. Gone. Still sterile. Go ahead and check the pulse with my non-dominant hand. Make sure she's doing okay. Are you doing okay?
Yes.
Okay. So we're only going to go in that one time. Got a good amount of secretions. Go ahead and turn the equipment off. Disconnect the catheter. Take my chucks and kind of wipe away the patient. I'll put the oxygen back on. Listen to the heart and lungs again. We'll listen to the lung sounds again to see if it was effective. Take my gloves off. Wash my hands. I'm going to go ahead and position the patient back down. I'm going to go ahead and put you back down, okay? Now, do you mind staying up a little bit? Staying up this high for a little bit. It'll help you get up those secretions that we just kind of loosened up, okay? Just for about 30 minutes. Is that okay?
Yes.
Okay. We're going to leave her up for a little bit. So the bed is down. Equipment is off. Wash my hands. Put the call light in reach. Open back up the curtains. And we're done.